Mitral valve prolapse is the most common valvular disease in developed countries, occurring in 2.4% of the population. Listen to the mid-systolic click and late systolic murmur of mitral valve prolapse. I will start with 3 normal beats, and then add the click, and finally the murmur. Mitral regurgitation is divided into 2 categories, primary and secondary. In primary mitral regurgitation, pathology of one or more components of the valve apparatus causes incompetence. Mitral valve prolapse is the most common cause of primary mitral regurgitation in developed countries. Listen once again to the murmur of mitral valve prolapse. Mitral valve prolapse has a wide spectrum of presentation. Younger patients often present with marked myxomatous degeneration and have a long history of a heart murmur, so-called Barlow's valve. Patients older than 60 may present with fibroelastic deficiency disease, in which a lack of connective tissue can lead to chordal rupture. Listen once again to the click and murmur of mitral valve prolapse. The click and murmur are usually heard best at the cardiac apex, but the click may be heard throughout the precordium. The click and murmur are affected by dynamic maneuvers such as squatting. Moving from the standing to the squatting position causes the click and murmur to move later in systole. Listen to the change in the click murmur with a squat maneuver.
Standing. Squatting.
In a classic study, researchers demonstrated that the click always occurs at the same ventricular diameter. Maneuvers like squatting that increase left ventricular size at the start of systole cause the click to move later. However, maneuvers like standing that decrease ventricular size at the start of systole cause the click to move earlier. Listen once again to the change in the click murmur with a squat maneuver.
Standing. Squatting. Standing.
This table shows that as patients with mitral valve prolapse progress through the 4 stages of primary mitral regurgitation, there are increasing degrees of anatomic and physiologic pathology that correlate with progressive amounts of mitral regurgitation. Listen once again to a patient with mitral valve prolapse. Mitral valve surgery is recommended for symptomatic patients with severe mitral regurgitation secondary to mitral valve prolapse and an ejection fraction greater than 30%. Mitral valve repair is preferred over replacement if a successful and durable repair can be achieved. The success of valve repair is dependent on both valve morphology as well as surgical expertise. Mitral valve surgery is also recommended for asymptomatic patients with severe mitral regurgitation and left ventricular dysfunction. Repair is especially recommended for patients whose disease is limited to the posterior leaflet. Listen once again to a patient with mitral valve prolapse. In summary, mitral valve prolapse is the most common valvular disease in developed countries. The classic click murmur complex moves later with a squat maneuver. Mitral valve repair is preferred over replacement in patients who need surgery. Listen once again to a patient with mitral valve prolapse.